This is Sam, who's known to his friends as an outgoing and energetic guy. But on one unlucky day, Sam's car skidded on ice and slammed into a light post, almost killing him. He was airlifted to hospital, required multiple surgeries, as well as a stay in the intensive care unit, also called the ICU. Sam's partner, May, visited him in the ICU, and she immediately noticed something was wrong when Sam was quiet and withdrawn. May alerted the healthcare team, who, having just met Sam, didn't know much about him yet. It turns out that Sam had acquired a life-threatening infection following his surgeries. Despite advances in treatments, almost 25% of patients admitted to the ICU experienced something called an adverse event. Adverse events are unintended complications of medical treatment, like the infection Sam had after his surgery. Adverse events cause significant patient harm, including death, but over half of adverse events are preventable. While healthcare professionals work to minimize the risks of adverse events, families are an underutilized resource in identifying and preventing adverse events. Families know their loved ones best, and during their visits to the ICU, they could detect changes that are potentially missed by healthcare professionals. My research uses 26,000 patients across 15 Albertan ICUs. I extracted adverse events from medical records, but since family visitation isn't routinely tracked in the ICU, I used a natural language processing algorithm like a detective to look through the vast amounts of written information in a patient's file for specific keywords like visitor or family. I then combined the information from patient records and my custom algorithm to compare the number and type of adverse events in patients who had a family visitor and those that didn't. My research found that family visitation was significantly associated with a reduced number of adverse events. That means that family visitation was beneficial for these patients. I like for my research to help develop tools for healthcare professionals to check in with families and influence policy in a way that encourages families to visit and advocate for their loved ones. Thanks to May's observations, Sam was quickly prescribed antibiotics and another surgery to remove the infection. I want for my research to help more people, like Sam, leave the ICU healthier.